Funding for this program is provided in part by the Minnesota Arts and Cultural Heritage Fund and the citizens of Minnesota.
One of the most prevalent conversations amidst the pandemic is the terrible effects social isolation and loss has had on mental health of communities around the world. While vaccines are becoming more widely available, many of us are facing challenges that can be stressful, overwhelming, and cause strong emotions in adults and children. Public health actions such as social distancing are necessary to reduce the spread of COVID-19, but they can make us feel isolated and lonely and can increase stress and anxiety. With us today are Sean Kinsella, the Executive Director of NAMI, the National Alliance of Mental Illness, Southeast Minnesota, and Ashleigh Dowis, the Director of Clinical Services of Family Service Rochester. Sean is a passionate human service leader with an extensive experience in organizations serving seniors and individuals with disabilities throughout multiple metropolitan communities. Before coming to Rochester, Sean owned the Right at Home branch in the Northwest Twin Cities, dedicated to serving seniors and surrounding communities with in-home care. Sean has been with NAMI Southeast Minnesota for about 2 years. Ashleigh is a strong healthcare services professional with a Master's of Science in Education focused in community counseling from the University of Wisconsin-Oshkosh, and a postgraduate certificate in marriage and family therapy from Capella University. She is an experienced clinical supervisor and psychotherapist skilled in cognitive behavioral therapy, group therapy, psychotherapy, marriage and family therapy, clinical supervision, and program development. Ashleigh has been with Family Service Rochester for over 3 years. Thank you both for being here today.
Thank you for having me.
Yes, thank you.
Thank you. So what we want to do is talk about a little bit about your own mental health experiences while handling the COVID-19 pandemic. We know that that has been quite the impact in the last year and more. And so we just want to dig in a little bit about what has been your own experience.
Want to go first, Ashleigh?
Sure. Throughout the last year, really, COVID-19 has offered opportunities for, I think, a balance of things. There have been losses of traditional gatherings throughout the year. For instance, my family lives in Wisconsin. We chose to not go back over the holidays, especially with the surging cases. So that changed some of our routines and celebrations for my family. My son went distance learning in kindergarten last year and spent most of his first grade in a hybrid scenario, not what either of us would have thought his introduction into the educational system would have been. Somehow, I think we've come through very resilient and able to manage some of those changes in unique ways.
Ashleigh, I think your story is quite relatable to many in the community. What about you, Sean?
Yeah, I think on a very personal level, it's been, sometimes it's trying to run a mental health organization and be impacted by the overwhelming need. I think how people who've never had mental health have suddenly begun to experience mental illness through anxiety, that separation, that loneliness, depression. Sometimes it feels like I've got so many balls in the air trying to provide all these services that I myself feel completely overwhelmed some days. And some days I feel like it's not working, right? That I'm not delivering the service that we're capable of. So that has a real impact on my own personal health. I always want to excel and exceed and meet everyone's expectations, but it happened so fast and in a way that I think so many organizations weren't ready for, that it was really hard to get our feet under ourselves. And I know that my employees here at NAMI have also struggled with mental health during this. It really changed everyone's life.
That is a perfect segue into the next question I have. And how has COVID widely affected the population when it comes to mental health? What have you seen in the community and what you're hearing?
I think, if I may, I think Sean started talking about anxiety and isolation and things that were common situations that people found themselves in. So from the parenting lens, trying to juggle all of the things, being now a distance learner supporter, having their own work, changes and shifts and unpredictability and flexibility as we navigated through the last year. And then also some parents and adults lost jobs during this time. So there may have been some economic stressors that weren't present before and unexpected. So the anxiety, the worry, maybe a sense of hopelessness. When is this going to end? So that life can return to normal. Those sort of things, I think, impacted people's threshold for managing stress.
Right. And when that stress is pretty chronic, it's hard to put an end date on it. And with a pandemic, it's ongoing.
Mhm.
What about you, Sean? What have you seen?
Yeah, I think so. I believe that there are various levels of impact, and everyone is seeing it and doing a comparison. How is this impacting my life, and why am I experiencing something very different than someone else? So I think the other piece with work is, especially for large organizations that went virtual, employees actually are working more than they normally would have had they been in an office. And after a year, that has become a total grind, and it has absolutely deteriorated people's mental health. Some people are working 12 hours straight because their company's international. And so because nobody's coming to meetings and you're physically going into an office where everyone would meet, if you're in an international company, you might be getting up at 6 a.m. for a meeting and then trying to resolve something at 6 o'clock at night. And there's been no break. So I definitely think that how people experience it is very unique, but the impact is very generalized across all stratas of our society right now. Everything from the deniers to the people who became immobilized by fear. This is all added to it, and it just stacks on top of each other to create a larger sense of dread, worry, depression, anxiety.
Sean, I think you nailed it when you said it can be very individualized, but there is this general experience too. Ashleigh, what have you seen among children and teenagers who have had to deal with the loss of school, friends, and common experiences for a long time there? Many of them were home and weren't able to be involved. Some of them have gone back. Some parents have kept them home. So what do you see amongst that population?
I think the most common reason children or adolescents are coming in for pandemic-related issues or challenges would be because of worry and anxiety and depression. So parents would be noticing changes in sleep or eating habits, disruptions in relationships, and not finding a way to have that social connectedness that is so important in our social and emotional development in childhood and adolescence. I think when we think about children experiencing changes, children are also very resilient. So there's a spectrum of responses that come from each child based on their constitution as a human, the environment that they're in, the supports they have around them, and the propensity to be able to access services. So children not being in school maybe didn't have as many services as readily available or as in person if needed. So I think we saw some setbacks with that. But again, children are resilient. and are able to catch back up. I think the unique thing that children are experiencing, or school age children are experiencing, is that, like my first grader, all first graders in his class experienced a similar disruption and reintegration. And much like students who have been in completely distance learning, there's other individuals or students that have gone through the same thing. So there'll be ways to support each other as we move through and hopefully to the other side of this.
And there's, you know, the social emotional intelligence that you kind of gain when you're in those environments.
Mm-hmm.
Do you see kind of a regression in that and kind of catching up as that moves forward?
So when I look at developmental growth in social emotional areas, I'm looking at a child in relationship to their peer group. So if we're looking at a group of 7-year-olds, likely they have all advanced or step back in the same sort of way because of this. Obviously, there's going to be those sides of the spectrum where there are unique experiences in that. I think that we are seeing, as much as we are seeing maybe social skills not be as we know them, they are learning social skills in a different way. So social skills and etiquette in this sort of environment, where they wouldn't have gained that maybe if we were all in person. And this may be a life skill that translates to adulthood for them, being able to engage in a virtual way. So I think with any setback, there's also an opportunity for that to be looked as a strength and a skill, because something else needed to be learned in that situation.
That is such an interesting point and such a valid one, connecting the dots on that. How have families with young children handled the pandemic?
I think when I am hearing parents with young children, we are seeing them, I think with young children in daycare closed for a period of time, or maybe intermittently closed. So those caregivers that a child is used to seeing in their daily routine had some disruptions and continue to in different ways. So I've seen families come together and be more at home, enjoying each other's company, also needing to safely bring in caregivers to help have a break. All parents need a break and take care of themselves. So a lot of the work we've been doing with young kids, and it really comes back to parents taking care of themselves, creating a new structure and routine safely, keeping connections with the young children they have.
Especially if you're working from home and
Yes.
they're in the background, you're having a
Mhm.
meeting, they might pop in, that sort of
Mhm.
thing. That's definitely can be a stress inducer. But I like how you
Yeah.
captured how it can also be a moment for families to connect as well.
Mhm.
Sean, what have you seen in the older population? How have different care facilities and older community members who live alone handled the pandemic?
So I believe we actually talked about this last time we were together. And at that time, we saw seniors doing a really great job handling it. Right there, unfortunately, part of that the later stages in life is shrinking social network because people are passing on. And so I think originally they were handling it very well in stride. They were okay with being alone. They were used to long periods of being alone. But by the end of the year, I believe that really started to impact them, that it had been so long and that loneliness really started to creep in. And so we saw seniors really needing more help than what we originally saw at the beginning of the pandemic. I believe that the inoculations have definitely opened the doors for people, that they feel safer, and that is changing their ability to access the community. They're willing to go out. So on that part, we are starting to see a reprieve, whereas I believe in December, it was a very tough time for seniors. We definitely saw an increase in need.
Yeah, you weren't able to hug them and, get close. They didn't see family members and that sort of thing.
Yeah.
What do you think was the biggest impact on mental health out, with the isolation and other aspects? Anxiety or?
Yeah, I think, well, anxiety and depression, they often look very much alike. They have a lot of the same symptoms that exist. I think, so there were, in looking back on it now that we're able to start looking back, we saw people who were immobilized by fear and really locked themselves down. So not even going out and taking a walk, right? They were afraid to be out, that they would catch the virus on the wind. And so they weren't able to engage in all of the psychological skills that we have all learned to kind of mitigate our mental health, right? So some of that is going out for a walk, exercising, taking the dog out, going to church, going to other social functions. And when everything becomes a fear, going to the store, for example, you're afraid of it. You literally start to just become afraid of everything. And there's this whole wall that gets built around people, that they weren't willing and able to access the community and access their support systems. And that, I think, was the real crux of COVID, is that it happened so fast. People were not able to build new skill sets to be able to adjust to a changing life. And so you did see some people who isolated and really shut themselves off from the entire world and kind of suffered in loneliness. And you saw other people who just said, I'm sick and tired of this, and I'm just not going to obey any rules. And that created a whole level of anxiety out in the community as well. So there were a lot of repercussions that happened, and it'll take us a while to sift through and really understand who was impacted by what. But in general, we do know that there were two extremes that happened, but both of them really had at their core anxiety, and it was the exact same anxiety. It was just how people chose to kind of insulate themselves.
You brought up a perspective that I think is really important, is that long-term impact. What does the future of handling the nationwide trauma look like? And do either of you see a way going back to normal? Is that even possible?
I'll jump in and say there's just not enough psychotherapists out there. So that is number one, the biggest impact. Is that there is more need than there are people able to support. The other thing, of course, is still health insurance is the primary mechanism for people to get into psychotherapy. And so if your insurance doesn't pay for that, the options really become limited. So we are seeing more people accessing our services because they can't get services through their regular routes. There are some incredible waits out there. We're talking, 2 to 3 months to see a psychotherapist right now. So people are literally having to sit in their anxiety or their depression and kind of work through it. That's been the impact so far.
What about you, Ashleigh? And then I want to ask you both what other gaps you see happening as well. Go ahead, Ashleigh.
Sure. So we know when people sustain stress over a long period of time that there are impacts to health. So we see and that manifests differently in every individual. But we do know that there's a strong connection between the two. So I think when we're looking at returning to normal, we're going to have a new normal. And I know that's been said a lot, but we've already started creating how that looks since the onset of the pandemic. I think that we will have a story following this that will give us some information about how people fare during this time. And it's going to be in hindsight, and how can we build up different layers of support, as Sean was talking about, so that mental health care is a part of everyday life. And there's different ways to access that, so that stressors can be dealt with more immediately.
Many people say, well, physical health, people really, identify with that. They talk about it. It's normalized. Mental health is not, and you mentioned that there's not enough people to help support and provide that care for mental health. What other specific gaps do you see happening and what's needed in the community?
Yeah, what we've experienced here at NAMI is a lot of individuals who had years of success at being sober have backslid. So we're seeing more people who are engaging in substance use than we have before. Normally, it's about a 50-50 split. So 50% of people with mental health use substances. 50% of people who abuse substances also have mental health. We're seeing that those overlaps become larger. And unfortunately, people have, to use the old phrase, they've fallen off the wagon. That will have long-term impact. People will need a lot of support to regain that independence that they had from not using substances. And that has ripple effects. It affects your job. It affects your family relationships. Often finances also fall behind that because people are putting their money into the substances instead of paying their bills, and establishing those nest eggs that everyone needs to help them, overcome even the smallest thing like a car repair. So we are seeing that there's going to be greater need in that area.
I agree, Sean. I think that even individuals who maybe didn't have a substance use disorder, as we know, individuals were drinking more during the pandemic, and likely using substances more as well. So I think coming on the tail end, hopefully in the other side of this, I think having more of that co-occurring approach to mental health care, where we are helping the mental health professionals we have also have that chemical health lens to be able to meet the need that may be coming. Prior to the pandemic, there was a national shortage of mental health professionals. And if we look at it from a lens of mental health professionals are doing everything they can to see who they can, but there's still just simply not enough of us. So if we could somehow, and I think we are really trying to build up that field to be something that's desirable to go into, to be able to be a helping professional in any sort of way, can help that gap.
Well, it is quite obvious that your organizations and you are invaluable and your work is very necessary. What are some resources available that people can go to get help, and how can the community come to support mental health issues?
So the first thing I always point to is if you're employed, look at your insurance policy. Most insurances have employee assistance programs out there. So that is a great place to reach out to and find out what they offer. That is covered. That is part of that insurance package. So that's the first thing to go. The second place is to call your insurer directly and say, I'm struggling with mental health. What can you help me find in my area that has openings? Those insurers know exactly who they contract with. That is in their database, and they can connect people much faster than a cold calling process, where people are like, oh, I had great success with this agency, and then you find out that your insurance isn't accepted. So those are the two resources I direct people to. The other thing that we have is There is a lot of the social service agencies in the Rochester and surrounding communities have a resource book that they can pull out at any moment and access various needs. So if you're talking with any of your social service agencies, they have resources that they can direct you to that may not be on their website. So if you're trying to peruse it using the internet, you may not find what you're looking for. So those are the 3 top ones that I encourage people to use. Also, you can just call. Half of what NAMI does is we refer people and connect them to other agencies. We kind of keep a list of the agencies that do a great job, who have sliding scale fees, which I will give a plug to Family Services Rochester for, because it's not always just straight insurance or private pay. We are seeing more and more larger mental health organizations move in, but they actually want to go after the fee-for-service dollars. And really what we know is people on the Medicare, Medicaid spectrum of insurances, they're the ones that also need support as well. So Family Service Rochester is one that does a great job.
That's helpful. Go ahead, Ashleigh.
So if we're looking from a parenting lens, and I'm getting reports from my teacher, school staff that there are behavior. So in children, typically externalized behavior is the pathway into some sort of helping service. So if a parent is hearing those things, working with the school social worker or counselor to access services. So in Olmsted County and other counties throughout Minnesota, there's school-based mental health. So there are therapists co-located at the school that the school counselors and social workers and administration can help you get connected with as a parent if you're seeing those kind of disruptions in the home setting or in the school setting. So that coupled with Sean's comment on calling insurance and making sure the professionals in network, I think are really 2 great ways to access services initially. If you are looking for an agency to go to, ask somebody. I know Sean mentioned that, but ask somebody, where did you receive really great services? Typically, we look for those recommendations, whether it's a doctor or a dentist or, where to go get the best deal on something. If somebody has had a good experience somewhere, that can make that process feel a little less worrisome or scary. I also think, as I mentioned, or another access point could be during a routine visit with your doctor if you see somebody regularly. Or even if you have a faith community, a lot of those leaders have not only skills themselves as in their role, but have resources to connect to. So there's a lot of different access points to services. It takes that first step of asking somebody about it and making that call. And we work closely with a lot of the mental health agencies in this community, and we are all helping professionals. So if somebody calls FSR and we don't have that service, I'm going to make sure that I have a number and a name for somebody to call at a different agency so that people are getting the help they need.
Well, Sean and Ashleigh, I am so grateful that you're in the front lines and that people are getting the help that they need, and they know that they can get information from you if they need to be redirected to somewhere else. So thank you both for your work and for your organization's work.
Thank you so much. Thank you for the spotlight on mental health right now.
Mm-hmm.
Well, you both are incredible. Thank you so much. And I am Danielle Teal with KSMQ Public Television. Thank you so much for watching, and I hope that this was helpful for you.
Funding for this program is provided in part by the Minnesota Arts and Cultural Heritage Fund and the citizens of Minnesota.